When I was doing my public health training, I worked in Coventry, and I worked for Professor Sir Michael Marmot there and his team when we did that review that he actually just mentioned, so that was quite nice to hear that. And that sense of understanding how those national things have changed, it is really, really sobering, and there is a huge amount of work that needs to be done to look at the direction that we are headed as a country, and hopefully to make changes to that. But that said, it doesn't mean that we're hopeless. It doesn't mean that we can't do anything here locally. And the big thing for me, just being here, knowing how many people signed up to come today, and and seeing you all here today, is that so many people in this city care. And if you care, you can make a difference. You might make a difference to one person, you might make a difference to 1,000 people, but everybody here makes things happen, makes changes happen. And I'm also very mindful that there are probably 5-10 times as many people who weren't able to come today, who may not even realise the role that they're playing in tackling inequalities, but they are doing it. And we want to recognise the challenges, but also celebrate some of the successes. And that's partly what I'm going to take us through with my slides. If I just press the wrong one? No, that's right, sorry. I don't need to look there, do I? I can look down here. So, the start of Thrive Plymouth, as many of you will recall, and it has just been mentioned, it really went back to a massive report, a big academic piece of work that was published, which was called The Global Burden of Disease. And what that tried to do is look at what were the underlying causes of all of the deaths, in fact, globally, and break it down to what was happening in the UK and in other countries. It was very technical language, but essentially it started to draw out some of the risk factors for the diseases, those diseases that were killing people and that kill people early, because obviously, we do all die of something, but it's the early deaths, that early deaths that we're trying to understand and trying to stop happening. And as we've already mentioned, the factors that came out were things like smoking, having a high body mass index, other diet-related risks. It talked a lot about blood sugar and hypertension, high cholesterol. It's quite technical. So what we did locally is work out, well, if we make that a little bit simpler and look at what happens in Plymouth, what do we come up with? And as many of you here, I know from seeing the faces will recall, we came up with the 4454 programme, which was around recognising the 4 behaviours that led to the 4 main diseases that were causing 54% of the deaths. And within those deaths, a lot of those deaths were earlier than they should have been, and they were linked to these inequalities that we see. The first thing that did is get people talking, which was brilliant. So I had lots of conversations with people about the technical details of that. Kelechi was leading the piece of work. I'm sure he had many as well. And there are lots of ins and outs of the technical way that you count this and you count that. But the point was everybody was talking and everybody was beginning to listen and realise that actually there were things here that could be changed, that had the potential to be changed. So from these, we started to look at more positive framing of Thrive Plymouth. We don't want to talk about deaths. We're public health people, so unfortunately we do a lot of time looking at deaths and analysing deaths. We don't want to talk about deaths, we want to talk about living. We want people to have good lives and healthy lives and thrive. And lo and behold, Thrive Plymouth was born. The big thing I would say, though, that we've learnt over the last 10 years since that launch is that you can't simplify everything down as much as perhaps we might like to. You can't look at a behaviour, you can't like smoking or diet, without thinking about what's driving it. What's the social determinants, as Sir Michael Marmot was talking about? What is it about the places perhaps that people live in that restricts their choices? The world that they're living in, the adverse childhood experiences they might have had. There are a myriad of things that alter people's choices. They're not free choices. It isn't that anybody chooses to do something that's going to make them ill and kill them. It really isn't. So our job is to understand much more about that rather than just saying, and I always think that when somebody says, well, just tell people to stop smoking. If only it was that simple. It isn't, and it's our job to understand more and more about that complexity and why it's difficult. So, the annual themes. So along with the launch of the programme, we decided to try and have an annual theme. And the reason for that is exactly why we're all in the room today. It was because we wanted to engage a really broad range of people in understanding about health inequalities and in tackling them. So public health traditionally works with the NHS. That's great, but what, 20% at the most of the difference is made by that? That's not where the inequalities come from. It's a factor, but it's not where the inequalities come from. So we wanted to go out, talk to people, meet people, and by doing the annual themes, we kind of drew people in and got them talking and got them working with us. So as you can see on the slide and has been mentioned, we started with being at work. Being in good work can be good for you, it really is. So that's fantastic. But what are all the opportunities of making workplaces a bit healthier, of getting your numbers checks into workplaces so that perhaps people who wouldn't normally know might pick up on early issues that they might have, and support them with health check programs and the one you Plymouth programme on smoking cessation and things like that. Getting into workplaces was a really big thing, and the relationships have continued and grown. As you can see, the themes continued, and I'm going to go through each one of those in a little bit more detail in a second. So here we go. I have some photos from the Healthy Workplace. I thought I did. Clearly, a really big programme, and it has persisted. So many of the big employers across the city carry on putting a lot of focus into workplace wellbeing. Live Well South West do our health improvement. They have our health improvement contract, and they run that programme. They are out supporting workplaces to help to make their workforce as healthy as they can be. And I emphasise that because that was launched 10 years ago, and that programme's still continuing. So we are making a lasting impact to what happens across the city. The second year was around schools being a place where children had the opportunity to be healthy. We know there are some awful stories of how children and how some children in the city and across the country are going to school hungry and things like that. We had to do everything that we could to make the school situation something that could support children. And we used the Healthy Child Quality Mark to help to do that. And our schools absolutely engaged in that, and again, a lasting legacy from the work that's happened around that. And I would say that one of the things we have seen in Plymouth, which has been flagged as going against the national trend, is that we do have a high rate of overweight and obesity in our reception-age children, and that does very, very closely track with deprivation. So it's actually exactly what we'd expect to see. But we do see that by the time we redo the measurement of children in year 6, so they're aged 11, we are actually better than England now. So for a deprived city to be better than England, and we've been better than England consistently for the last 3 or 4 years. Very occasionally we dip down to being only as good as England, but that is, a very interesting thing. We can't attribute exactly what it is, but there's some real positive outcomes. Next we move on to 1U Plymouth. So big shout out to the Live Well South West Health Improvement team here. There was a national campaign around 1U, and we managed to make it very individualised to Plymouth, and it became very Plymouthian. And in fact, the website that it was launched on was actually swamped by people from Plymouth. So nationally, we were marked as being having the most hits on that web page, which is not something I would particularly have expected, but it happened fantastically. We also launched some programmes with Plymouth Community Homes, looking at how we could support people to be that little bit healthier. So things like a support pack when you first move in, new home, new you. How can we help you make some of those small changes that can make a really big difference? And we also worked quite a lot on making sure that brief interventions were happening around those things like smoking, drinking, weight, and physical activity, moving more, so that we could make sure that people were being signposted to support where they needed it. We definitely know that just telling somebody to do something won't make it happen, but we do also need to tell them that it could help, don't we? We have to make sure we get that balance right. And so there has been a lot of work done around that. And a number of other things. There's always, with any of these themes, I should say, the work for that theme has continued onwards. So rather than it being, stop, start, this is actually parallel streams of work that just keep on happening. So lots of fantastic work around that, and Live Well are here if anybody wants to catch them to see what they're doing and what they have to offer. And I think you can have your blood pressure checked too if you want. The next year, we had a focus on mental well-being because we felt that the programme was talking about the behaviours a lot, but actually if your mental health and your mental well-being isn't in the right place, you won't make those positive changes because there are barriers to making healthy changes, and the barriers are bigger the more deprived you are, the more you live in those more deprived areas. So we wanted to really try and think about how can we support people with that kind of low-level mental health. Obviously, some people need much more than this, but that sort of general low-level mental health and well-being offer. And the 5 Ways to Wellbeing is a really well evidence-based programme, and we used it during this year, but it really embedded itself and it became very important when we moved to a few years in the future from this, which I'll mention in a second, that COVID word again. We also, and this is probably the thing that sits with me as the most important thing that I feel I've contributed to, was the first Wellbeing Hub was launched. And the Wellbeing Hub programme came from listening to all of you, really. We had system design groups to understand what could we be doing better. And I will always remember one of our GPs came to that meeting. He was sat in a big room. We were all sat there talking, and he said, the problem is the patients that come to me, I can give them a pill, but what they really need is help with a house, with getting a job, with getting a decent income, with feeling like they've got something to live for. And there's nothing for them. There's nothing for them. And 3 or 4 people said, we're just around the corner from you, we can help. And that was like the switch that went, right, okay, what we need to do then is we connect the people that need it with the help that's out there. And through working together, we work so collaboratively together, and our wellbeing hubs are not, they're not Plymouth City Council buildings or owned by us or anything like that. It's you guys, it's the community, those hubs in the community that said, we can do something for our population, we can help to organise it better, we can help to support social prescribers and all of those things. So that started back then, and obviously the programme is continuing and growing. And I just think is a brilliant programme, and it's doing so much good. So, connecting people through food we moved on to. We worked with Food Plymouth around the Sustainable Cities Award, and that was a really major piece of work to be able to get that silver award. And also with a really wide range of partners. And it isn't just about what you eat. Isn't just about eating healthy food, it's about enjoying the process of perhaps you want to grow it, perhaps you want to work with the orchards or with some of our community allotments and things like that. Perhaps it's part of growing it, perhaps it's about sharing food together, being sociable together. So many factors around food are really important. I mean, it's also really important that we are embracing the sense that food can be enjoyed. And eating healthy food isn't a life sentence of boring food. There is plenty of really great food that you can have. But we wanted to really understand what the barriers are to people being able to do that. So looking at where you can get fresh fruit and vegetables, looking at the costs of it. Many of us might hop in the car and drive to a supermarket. That's great. What if it's not a car? You don't have a car, but it's 2 rides on the bus. Oh, and you've got, a toddler and a pushchair that you've got to manage along with your bags of shopping, and all these things just, they do really, really add up. And we did some work looking at how much a sort of healthy basket of food would cost if you went to your local shop, and the increase in prices is just, I'm sure many of you know, but it's just extraordinarily high. So yeah, so lots and lots of brilliant work around that, and this did lay the groundwork, because unfortunately, as you probably realise, we were close to going into a global pandemic. Who'd have thought that? So we launched Year 6, and it was chosen to align with the Mayflower 400 commemorations. Lots of excitement around that. There were a huge amount of events that were expected throughout the year. And then, of course, events overtook us. And the next couple of years, we obviously stopped having the annual themes, and we focused very much on the COVID pandemic. But we focused on using all of those community resources, and my God, did Plymouth come together. I mean, that was, again, just an immense, amazing to see how that happened. I was slightly in a little bubble worrying about what this disease epidemiology was and what we needed to do to protect people. And then you kind of open the door and look outside your bubble for a minute and think, oh my God, there's good neighbours schemes popping up everywhere. There's people that, are volunteering because they can't do their current job and going and seeing people and taking supplies to people. And just that sense of people coming together was amazing. And we did get through the pandemic. We had less impact than some other places, definitely. Partly because of our geography, I think, where we were sat, but also probably partly because of the way we worked together around that. The community just got stronger and stronger. And it was a difficult time, and to just see all of that happen was just amazing. So then we picked ourselves up a little bit at Year 7. So Year 7, but of course it wasn't Year 7 in terms of because we had actually missed a couple of years, but Theme 7. So we did a session on listening and reconnecting. So we had meetings to talk together, meetings like this, but on a much smaller scale, to have those conversations about, okay, what do we need to do now? What do we do? Where are we? What does it look like? What does the environment look like in Plymouth? And what do we need to do to understand what that's like, and to work together to try to get back on track, pick ourselves up again, and get this programme back motoring. And it was about that time that the Community Builders team was born. And this was really built on that sense of communities needing communities having so many assets, but the coordination of them and the knowing what was happening, that was the bit that we were struggling a bit with. So the community builders have taken an asset-based, as you know, an asset-based view on communities to try to connect people up, connect communities up, understand what's going really well, and really build on that. And I'm really pleased to say that programme is continuing and doing fantastically. Focused around certain geographical communities, those communities that we know that are in need, and some of the sort of communities of interest and practice as well, that they are working with. And they have a stall at the back as well, so please do go and have a chat with them. And then moving on into Year 8, where we live. So we tried to take an approach about the actual places that we're living in. Looking at things like poor housing, cold and damp homes was mentioned. How can we fit with that? Also working with Plymouth Energy Community and other social landlords around the city. They do amazing work to try to support tenants, and we wanted to try and tap into some of that, understand what was going really well, and see where we could perhaps, again, make more and more connections and more links together. And then, of course, we were then rapidly approaching, believe it or not, the end of a whole decade of Thrive Plymouth, and this was launched as a 10-year plan. Can't believe how quickly it went, but it was launched as a 10-year plan. So we started to gather feedback. So we did an evaluation in lots of ways. I say we, royal we. We had some fantastic help with doing that from one of our registrars. And we tried, hopefully most of you were aware that we came and we talked to many, many people. We got your feedback on what you thought about the programme and what it was doing. We also looked at all the epidemiology, looked at all of the numbers, and tried to see what conclusions we could draw. Some of the examples of the feedback are being shown here, and I think the point for me is that the network suddenly are so huge. And there's a quote around, I don't think there's any partnership that I've been involved with that isn't involved in Thrive. That's what it should be, because, that's what life is about. Life is complex, and it is about us being able to influence as many parts as we possibly can as somebody's life, within the limitations that we can do locally. I mean, we've heard that there are some things that need to be sorted out nationally, but what we can do locally, we need to do, and we are. And again, some more quotes there. I do think it has become a social movement. People do care, and I think it has united us into being able to have that shared goal and work together. So when we looked at the tangible impacts, that's sort of been mentioned a little bit already, there are some really positive things we've seen. Smoking rates are down. Some of the healthy risk factors that we look at in children have improved. Death rates from those 4 diseases have decreased. And life expectancy and healthy life expectancy have increased in Plymouth a little bit, and that's against a backdrop of, as you heard, stagnation. Men's healthy life expectancy has done really well. I don't really know why, but I'm sure I'm sure there's a reason out there. It's one of these things that we just have to do everything we can and see what happens. There are still challenges. I mean, we do still have that inequality gap. Our inequality in terms of life expectancy is lower than any of our, we call them statistical neighbours, so other areas that have similar deprivation to us. So our inequality has improved, actually, got less. We are doing something right, but we are in a backdrop of some considerable difficulty around that. And there is a full report on that, which, I appreciate not everybody wants to sit down and read a full report, but honestly, I would encourage you to have a look through the website. It's on the website now, and it is really interesting to look through it and see what is showing. So, sneak peek. So we've looked back at our decade of impact, and this afternoon we're going to look forward to our next 10 years, because this is going to be, we said it was a 10-year programme, guess what, it's another 10 years at least, because inequalities are going to be an issue for a long time, and we are going to keep trying to fight them as a city. So, the new framework that we're adopting, we're not losing the branding and things like that, you'll be pleased to know, but as has been mentioned, we really want to recognise that we need to look at the whole of people's lives and not just that behaviour. So the idea of, a healthy body, so yes, we do want to stop people smoking, we do want to help people to eat healthily, we do want to encourage people to be physically active, all of those things. But we also want to be bearing in mind that actually we need to have high levels of mental health and well-being to be able to do that. And that the place that we live in has a huge impact on how well we can do that, how easily we can make those changes, what the barriers are, and also our healthy communities. So, do you open the door, walk down the street and say hello to people and feel safe and feel comfortable? Is there somebody you can turn to if you have a problem? All of those things make a massive difference to our lives as well. And so we want to be explicit that those are things we're going to be working on. And we're going to talk a little bit more about that later. And Steve, wave Steve. So Steve Madden is the new Director of Public Health in 2 weeks' time, and he's going to take you through some of that, looking forward into the future. So this is the bit where I get emotional. Sorry, I've tried not to. So I just want to reiterate a massive thank you to everybody for the work that we've done together. We have been on a huge journey, and it's been a huge privilege to be able to work with you all. I am continuing to work with you. I didn't want to leave Plymouth, and I am staying in the public health team, so it's not a proper goodbye for me, but it is a goodbye for me as the Director of Public Health. And so it's a heartfelt thank you. I think we've made a difference. I think the strength of our network, the strength of our relationships is going to continue to make a difference and drive us forward. And I think we all care. You know, we all care about what happens to the people in Plymouth, and that is what makes a difference when it comes down to it. So thank you.